Welcome to a Reddit and Read video now. Serious. Doctors of Reddit. What are the red flags that people should look out for in order to avoid an incompetent or bad doctor? If they ask the right questions but don't pay attention to the replies. A lot of lazy doctors just have a script they work through. And so long as your replies don't completely throw them off, they just make their way through it without picking up on things like uncertainty when answering or nervousness or crossed wires. Also, if you were prescribed something or booked in for a procedure and so on, you should at least understand the basics of why you need it, what it's for. If you go to the doctor not knowing what's wrong, and leave still not having a clue what it could be, but with a prescription or a referral, find another doctor who'll spend a few minutes actually informing you. Sometimes that might mean telling you they don't know what it is. But that's a lot better than you leaving thinking it must be totally fine as the doctor didn't say anything other than come back in a few days if you aren't feeling better. Not explaining the diagnosis. Not giving alternative legitimate treatment options. Rarely is there ever only one good option, from an actual licensed healthcare professional. Edit. Words. Apart from choosing a good doctor, try to be a good patient too. Trusting the doctor plays a major part in the process of getting better. Rather than bad doctors, there are those that have a paternalistic attitude, thus leaving you feeling impotent. Choose a doctor you feel comfortable with. Prices have nothing to do with quality. In fact, most good doctors will not have an absurd fee. I have a rare medical disorder and happen to be in medical school. I have a team of doctors and it has taken me years to find doctors I can trust. The biggest red flag is when a doctor doesn't believe you. The only person who knows your body is you. If you think there is something wrong, there likely is. Find a doctor who will hear what you are saying and address your concerns, not dismiss them as here. Other red flags I've encountered are when doctors discriminate what treatment to give you based on how they feel you are as a person, i.e., whether to give you painkillers because they think you are a junkie, or not giving birth control because they think you are a slut. Make you cry. Tell you that your symptoms are all in your head. This is very rarely the diagnosis. So rare in fact, that a workup should be done. Then, if nothing shows up, this possibility should be explored gently, not crammed down your throat. Treat their medical staff or students disrespectfully. A doctor like this is not on your side. I promise. A doctor who doesn't have any empathy for your situation and just wants to treat the medical bit and get rid of you. As a patient, you should not be treated like a case out of a textbook. A good doctor will ask you how you are coping at home, what your biggest concerns are, and they should try to put you in touch with OT, social services, charities, advocacy groups to try and improve your quality of life as a whole. Someone who uses this kind of holistic approach is someone you want as a doctor. If they're unwilling to consider or acknowledge the limits of their abilities, knowledge. Obviously, they are the expert, but the best doctors in my experience will have the courage to say, I'm not really sure. Let me do some research. Not calling you back with lab or X-ray results. Very bad business. If they distance themselves from the medical community, claim to be persecuted due to their methods, or that they are a maverick with a unique treatment, this is a massive red flag that they are the outlier among evidence-based specialists and potentially dangerous. Probably the best current example is Stanislaw Berzinski. Medicine is a science and they are doing it wrong. Unfortunately, I don't think there's a simple way for people without a medical background to evaluate the competence of their doctor. We get credited with cures unrelated to treatment and blamed for misfortunes that could not have been reasonably avoided. Patient satisfaction has far more to do with a doctor's interpersonal skills than their clinical acumen. As a dentist, I have seen patients freak out when you tell them their tooth can't be saved. In few cases, Dentists are either lazy or want to make more money by extracting teeth and then replacing them easier. I work with a major top 5 hospital in the US right now. Apparently one of the major red flags for recruiters is if the doctor has changed hospitals many times in the past 5 to 10 years. When they ignore what you say or fail to take an accurate history, this is when misdiagnoses tend to occur. When they are overtly prejudiced regarding race, gender or disability, this can impact badly on your treatment. I think the biggest red flag is if your doctor acts like a dick to you. Doctors are people too, and they come in all varieties. If you meet a doctor and she is a jerk, never go back to them easier. There are plenty of doctors out there, and you can find one with empathy who makes you feel heard and respected. Don't let them talk down to you. Your feelings and concerns are valid regardless of what anyone else tells you, and you deserve to find a doctor who is willing to be there for you. Ask for a second opinion. Ask for a referral, or ask to be scheduled with a different doctor next time. If you feel like your needs were not addressed, ask for short follow-up, 1 to 2 weeks. If you go home and feel worse, call in. Ask for help. They may send you to the ER for $1 million workup, but that may be what you need. Scans, stat lab work. Don't settle. You may be the patient, but you can still be in control. TLDR, there is never a reason for another human being to treat you like dirt. If your doctor does that, find a new one. I can tell you the best way to find a good surgeon. Talk to the nurses and therapists who see their results. While they most likely won't tell you that a surgeon is bad, what you can do is call up your surgeon's office and ask them to give you the numbers of several physical, occupational therapy clinics they refer to. If applicable, then call the clinics and tell them you need post-op therapy with their clinic. Who would they recommend as a surgeon for their own mother? This will hopefully get their empathy engaged, and they will tell you which doctor is the best in their experience. Also, look online for reviews, and find out your doctor's license number, and research your state's public records to see if they have had any lawsuits filed against them easier. A few things that come to mind based on knowing which of my colleagues is incompetent. Prescribing you narcotics rather than exploring why you have pain. Ordering imaging but not able to give you some idea of what they're looking for, even if it's just ruling out X or Y. Ordering uncommon or expensive labs without being able to explain what a positive or negative result would change in their management. Prescribing an expensive drug without being able to explain the benefits over an older or cheaper generic alternative. Not performing even a focused physical examination. Thanks for watching a Reddit and Read video. Make sure to like and subscribe for new content.